traded in a 1 square mile area.
Such a horrible disease. So the Department of Health and Human Services, they are warning they are run out of money to fight the Zika virus by September. But they have got plenty to spend on all kinds of questionable studies. Well, listen to this. The Washington Free Beacon uncovering nearly $50 million worth conducted by the National Institutes of Health. Like $1.7 million on a refugee exercise program, $2.7 million on a truck driver weight loss program, or $3.5 million on a gay and lesbian obesity study. Elizabeth Harrington is a staff writer for the Washington Free Beacon and joins us now. Elizabeth, I got to say, you read this report and you're just stunned. You're speechless. You're wondering, how did nobody know about this?
Well, I mean, if you've been reading the Free Beacon, you're well aware of this spending. And so when the NIH comes out and says we got $47 million for Zika and it's not enough, I just felt like it was another opportunity to recap all the questionable NIH studies I've been reporting on for the past 2 years. And the ones you've mentioned, I mean, there's $400,000 to give gender affirmation to incarcerated trans women in San Francisco. They get as specific as that, and they throw this money around. And so really, I don't have a lot of sympathy for the NIH when they say they need more money, if they're spending so much looking at gay hookup apps and how babies think about food.
Well, the list goes
$3 million on a soap opera about HIV.
I mean, the list goes on and on, as you're saying. I mean, a study on the college freshman 15, that's a pretty easy one, beer and pizza, anti-obesity rap songs for kids. I mean, Elizabeth, then the next question is, what do we have to show for all of these programs?
There's not much. I mean, when you look at this behavioral research, lots of times the researchers come in and they have a hypothesis. They spend this money doing God knows what, and then they come out, they publish their results, which basically is self-explanatory, like the $3.5 million for lesbian obesity. One of the published results they found was that gay men have a greater desire for toned muscles than straight men. It's like, okay, that's really helpful in this battle over obesity. Another published result found, it was a study on children and how they think about food. If the kids were told that someone had sneezed on their food, they were less likely to eat it. So these are the findings we're getting for millions and millions of dollars of our money.
And the reason we bring it up is because there are real concerns about the Zika virus growing, even here in the United States. You think about the Olympics in Rio and how many people are going to come back, and does that just add more fuel to the fire there? What is the NIH asking for? When we talk about we need more funding for Zika, what do we need? They're asking for more money from us, right?
Absolutely, and that's a worthy thing. We need money for these outbreaks. The same thing happened with the Ebola outbreak, and the NIH was complaining they didn't have enough money. I mean, but you see time and time again, when you have a $1 billion budget, you're going to have millions of dollars wasted, and they've been pumping this out. A lot of these stories I've reported on, the funding just grows every year, and they don't get shut off, they don't get looked at, they don't get examined. That maybe this money should go to other worthy causes like fighting Zika.
Well, who approves these programs? Like, who has sent the list of these things we've been talking about and says, you know what, that sounds reasonable, let's put that much money there?
Exactly. It's bureaucrats in the NIH. I mean, they allocate the fund. Congress allocates the funding for the NIH, and then it goes through the huge agency, and you don't really have any oversight from Congress. It's really just bureaucrats and scientists approving this funding, and it almost seems like it's on autopilot.
It is a head scratch. All right, Elizabeth, thanks for being with us on this. Unbelievable stuff.
Thank you.
I mean, Coburn back in office for that, huh? He was on.